Dr. John Gordon here again, and what I want to do today is visit with you about porcelain veneers, the process of having porcelain veneers done. We get a lot of phone calls from patients about having and wanting to have porcelain veneers done, so I'm going to speak in terms of porcelain veneers, but this can be any cosmetic smile makeover also. From the time that you make your initial phone call to our office, we bring you in for a cosmetic consultation. And at this appointment, we spend time getting to know you as a person first, and then we do a quick clinical review of what's going on with your teeth and with your mouth, and then we sit down and visit with you briefly about some options. What is the best option for you to obtain the type of a smile that you're looking for? At the conclusion of the consultation appointment, we then schedule what is called a records appointment. At this time, this is where we gather all the necessary information that I need to do the actual smile design of your cosmetic case or your porcelain veneers. We take diagnostic impressions of your teeth, we take x-rays of your teeth, we take a lot of digital photography of your teeth, we do various measurements, just a comprehensive examination of all the information that I need then to start the design process. I then take all of this information home and I do the actual smile mock-up design myself on your models that we have taken. No one's going to know your case better than I will, and no one knows better what to do with the smile and the smile design than what I will. So this is why I personally go through the smile design process and do it myself at home. I think this personalizes it more for you as a patient. Then once I have the smile design completed, you come in for what we call the preparation appointment. This is where we do kind of all the heavy duty work. This is where we prepare the teeth, take the impressions, and then make the temporary provisional smile design for you and place them on your teeth. At that point, you have the opportunity to look at the design that we've created for you. We can make any changes that you see fit and that you would like to make on the temporaries. Then you come back about a month later, and what we do at that point is we take off the temporaries, we fit the final restorations on, you get to evaluate, and then you give me approval to seat the case. Once the case is seated, we polish everything up, make final adjustments in the bite for you, and the overall process is pretty much finished at that point. We then have you come back 2 weeks later for a follow-up to make any little minor adjustments that are necessary, and then we take some post-treatment photographs at that time. So from start to finish, from the time with which you make the initial phone call to the time with which the case is seated, can take anywhere between 4 and 6 weeks. And this depends upon the urgency of the patient and how quickly they want to move. So what we're going to be doing in the next number of videotapes, though, is that we're going to go into each appointment in depth and in detail so that you really know what to expect from each appointment and where each appointment then leads into the next, and how this process is done so that you yourself have the case exactly the way you want it, and a case and a smile that you're just very, very proud of and happy to share with others. So hope this has been helpful, and I look forward to visiting with you and sharing with you more.